Let's talk about a virus that is an absolute master of hiding in plain sight. Seriously, it's a threat that millions of us are carrying around right now, often for decades, with absolutely no idea it's even there, just waiting. Today, we're going to uncover the story of the virus that waits. So let me start by asking you a really simple question. Think way back. Did you ever have chickenpox as a kid? You know, those super itchy red spots that probably kept you home from school for a week? Well, if the answer is yes, if you remember having chickenpox, then I've got a pretty wild fact for you. The virus that causes a much more painful condition called shingles is already living inside your body. It never actually left. Okay, so this culprit has a name, varicella zoster virus, or VZV for short. And this virus is pretty remarkable because it basically has a two-act story. Act 1 is chickenpox, which usually happens when you're a kid. Act 2, that can happen years, even decades later, is shingles. It's the exact same virus causing two completely different illnesses. So this is what's so fascinating. After you get over the chickenpox, the virus doesn't just get cleared out of your system. Oh no. Instead, it retreats and goes into hiding, lying dormant in the nerve tissue right near your spinal cord and brain. You can think of it like a little sleeper agent, just waiting for the right moment to get reactivated. And that right moment is often when our immune system gets a little weaker, maybe from age or stress or some other illness. All right, so if that sleeper agent does decide to wake up, how would you even know that? This brings us to our first section, spotting the symptoms. Let's break down exactly what to look for from that very first weird feeling to the full-blown rash. A shingles outbreak, it turns out, follows a pretty predictable playbook. And what's so important to notice here is that first stage. For about 2 or 3 days before you see a single thing on your skin, you might feel this strange localized pain. People describe it as stabbing or burning, and you just generally feel kind of lousy. It's only after that when the classic rash finally erupts, with new blisters forming over a few days. Then they crust over, and in most cases they're healed up within 2 to 4 weeks. Now, the shingles rash has some very distinct calling cards that make it different from other rashes. Because that virus lives in your nerves, the rash literally follows the path of one specific nerve out to the skin. This creates this really striking band-like pattern that, and this is key, only appears on one side of your body. It stops dead right at the midline. You can see it here. It creates this totally clear dividing line. And that's why you'll often see it wrap around one side of the chest, or the neck, or the forehead, but only on the left or the right, never both. Okay, so we've got the rash down. But here's the thing. Shingles is so much more than just a painful rash. The real danger, a lot of the time, is what can happen after the skin is already healed. Let's dig into the complications. Yeah, take a look at this number. Up to 26%. That's a big deal. According to the data, up to a quarter of all people who get shingles will end up with some kind of further complication. I mean, think about that. For more than 1 in every 4 people, the rash is really just the beginning of the problem. And the most common of these complications is a condition called post-herpetic neuralgia, or PHN. This is nerve pain that just won't quit. It can last for months, sometimes even years, long after the rash is gone. People describe it as a sharp, shooting, or just a constant, awful burning pain. And it can be absolutely debilitating. And then you have the complications that are flat-out medical emergencies. If the virus reactivates in the nerve that goes to your eye, it's called herpes zoster ophthalmologus, and it can seriously, permanently damage your vision. And if it hits the facial nerve near your ear, you get something called Ramsay-Hunt syndrome, which can cause terrible ear pain and even facial paralysis. Both of these need urgent medical attention right away. So here's the crucial thing to understand. While anyone who's had chickenpox can technically get shingles, the risk of these really severe complications isn't the same for everybody. It goes up and up pretty significantly with age, and for anyone who has a weakened immune system. Okay, I know that all sounds pretty intense, but the good news is we are not powerless here. We have really effective ways to fight back. So let's move on to section 3, managing the outbreak. I really want you to focus on this quote because it basically says it all. This is the single most important message when it comes to treatment. Speed is everything. Getting diagnosed and starting treatment as early as possible is the absolute key to reducing pain, shortening the illness, and lowering the risk of all those serious complications we just talked about. So what's the game plan if you think you have shingles? Well, it boils down to these 4 clear steps.
First, and this is non-negotiable, see a doctor early, ideally within 72 hours of that rash first showing up. Second, they're probably going to start you on antiviral meds to fight the virus head on. Third, of course, is managing the pain. And fourth is preventing transmission, because yes, you can actually spread the virus to certain people.
Okay, so let's clear something up. Someone with shingles can't give another person shingles directly, but they can transmit the varicella zoster virus to someone who's never had chickenpox or the vaccine, and for that person, it would show up as chickenpox. This is really dangerous for certain high-risk groups, like pregnant people who haven't had chickenpox, brand new babies, and anyone with a compromised immune system. That's why it is so important to keep the rash covered until every last blister has crusted over. Managing an outbreak is obviously crucial. But what if we could just avoid the whole battle altogether? And that brings us to our final and honestly most important section. Prevention is the priority. And this statement right here from the source, it's as simple and as powerful as it gets. The single best way to protect yourself from getting shingles and its awful complications like PHN is vaccination. Period. It's the ultimate defense against this waiting virus. So let's just get a few things straight about the vaccine. Its main job is prevention, plain and simple. And here's something a lot of people don't realize. Even if you've already had shingles once, you can and should still get vaccinated to help keep it from coming back. But you've got to remember, the vaccine is a shield, not a sword. It's for prevention, not for treating a shingles outbreak that's already started. And that really brings us full circle. We've talked about the virus, how it hides, what the symptoms look like, the risks, and the solutions we have. So now the question I want to leave you with is a personal one. Are you protected against the virus that waits?